Hi everyone, this is Neil Writers here, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with a left-sided ear infection. They've been symptomatic for the last fortnight or so, and their symptoms included a blocked sensation in their ear, reduced hearing, otolaryngology, so that's a medical term for earache, and tinnitus. They visited their GP a week or so ago, and they were prescribed some antibiotic ear drops, and the antibiotic ear drops also contained a steroid which helped the patient felt reduce their inflammation that they were experiencing, and they felt they was really swollen and tender. However, they still felt blocked, the hearing loss was still present, and they were still experiencing their tinnitus. Their GP had prescribed another bout of these antibiotic ear drops that the patient was due to collect later today from the pharmacy. However, they were recommended to have their ears cleaned out prior to using the antibiotic drops, so it would allow the drops to penetrate and make contact with the skin. When you've got all this debris, sometimes the drops doesn't make contact with the canal wall itself, and so therefore they were less effective. Now, as soon as I entered the ear and started to remove some of this debris, I just wondered whether it was a fungal infection. We call that a fungal ear infection otomycosis. And in particular, I felt it was a strain called Candida. Now, when it comes to fungal ear infections, the most common strain is Aspergillus niger. And the common landmarks with Aspergillus niger are fungal spores. They can either be white or black, alongside woolly strands. So Aspergillus niger is very easy to distinguish and to diagnose. When it comes to Candida, it's a bit more difficult because sometimes a bacterial ear infection looks similar. You get kind of a creamy discharge, but I just felt this was a fungal infection just because it was a bit more, it was just a consistency. It was a bit more smudgy, a bit more like mashed potato, and there was some kind of black moles almost embedded within the creamy discharge. And just in my experience, this appeared to me more Candida. And as soon as I mentioned that to the patient, they informed me that they do suffer from Candida in other parts of the body, and it's a chronic problem. So I explained to the patient that I was going to write to their GP because I would recommend they undergo an ear swab just to diagnose whether they've got a bacterial or fungal infection, and which will enable them to receive the right treatment. If this patient's got a fungal ear infection, they're prescribed antibiotics, it can actually make their fungal infection worse, and that's because the antibiotics they can of course also affect healthy bacteria in the ear, and healthy bacteria in the ear help to prevent harmful fungi and bacteria from colonizing the skin flora. So the skin flora is an ecosystem that lives on the skin surface that lines the ear canal and the eardrum. And if you using antibiotics, it allows the fungi to just colonize more and reproduce. It hasn't got any competition. The competition has been defeated by the antibiotics. So using antibiotics for fungal ear infection can exacerbate their infection. Similarly, if you have a fungal infection and you put olive oil drops or spray in the ear, that can also worsen it because the fungi can feed off the olive oil. So one of the